Morning. It's a beautiful, crisp morning out there. Hope everybody slept well. We are going to start the Public Health and Public Safety meeting. It is 9:02 a.m. Oh, I'm just going to pick on somebody at this point. Elle, would you like to say the pledge, please? Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Can I get a roll call, please? Oh, sorry.
Mitchell, Butler, Costa, Dean Schlattman, Williams, Winfrey, Freeman.
Present.
We have a quorum.
Thank you. Can I get an approval for minutes, please? So we have a motion from Winfrey, second from Williams. Can I get a roll call, please?
Costa, Williams, Winfrey, Freeman.
Yes.
Motion carries.
I have no old business. New business, we have Caitlin Daly here with our map update. So Caitlin, if you'd like to come forward, you might like to let them also know what MAP stands for. And I would
Happy to take.
I would like to make it noted that at 9:04, we have a Raquel Mitchell. Oh, that's okay. Is it traffic? So we have a couple coming in late, so. All right, Caitlin, if you want to hit the star, I will get your mic on. Thank you.
Yeah, can you hear me okay? Yeah, perfect. All right, well, good morning, everybody. My name is Caitlin Daly. I am the program manager of the Will County MAP Collaborative. That is our community health improvement network here in Will County. And the reason we exist is to perform and complete our 3- and 5-year community health needs assessments, which are coming up all to be due next summer, 2025. The framework comes from the National Association of County and City Health Officials, and the framework did just go through a recent update into a 2.0 format to better capture community engagement, social justice, and equity throughout the process to make sure that we're capturing and telling a true community story. So what I passed around is a little 2-sheeter giving updates about my access to food and nutrition team. I did a little bit of everything. I did like some data points on there. I gave some action team updates. And then on the backside, the biggest portion is talking about the ARPA grant that the MAP Collaborative was awarded. Back in 22, and this was initiated by my predecessor, there was a very big ask that came out of the Will County MAP Collaborative. It was, I think, $4.1 million was asked in ARPA funding, and there was this big dream of creating a local food economy here in Will County that would bring in our local farmers, and then we would have our pantries and do like markets and have EBT. It was truly impressive. Of course, we did not get $4.1 million. We got $800,000, and we cinched in the scope of our work, and we focused on what was going to have the most immediate impact, which was investing and allowing some of our local pantry operators to expand their capacity. We selected 4 community partners, 3 Joliet, 1 in Monee. These are partners that I'm sure everybody knows very well: Salvation Army, Holston Human Health, National Hook of a Black Women, then New Hope Community Church in Monee. They've managed grants before, have done so in Fidelity, and they're really great partners. In receiving this money, they're, like I said, using that to expand their capacity. We have Holston and New Hope Church have invested a lot of money in developing like large community kitchens. On the backside, you'll see some snapshots hot off the presses. Those are pictures from New Hope Community Church. church. They just finished their install like Thursday, Friday, Saturday. They still have a couple things to finish up. They need to get their fire suppression system like synced in and a couple other finishing touches, but they were able to do that. You also see a picture of their big garage. They built that to store all of their equipment because the next phase is that they're looking at expanding their community garden in the area. They'll be using some of their funding for that. Holston, like I said, just submitted their request. They're spending about $60,000 again to do a big full community kitchen build out. That's going to tie into their Heal Pantry. So they're going to have clients who have they're elderly, disabled, stuff like that. They have priority to go into the pantry first. And then those individuals, it'll be a trial, like a pilot. They're going to be pulled into a program where they're going to take the groceries from the pantry, come into the kitchen and learn how to make meals with that. And then once they have that set up and solid, they're going to open it up and expand it to everybody in their residential community and then outside within their neighborhood as well. When they're a little bit more established, they're looking at opportunities to open the community kitchen up to allow for those entrepreneurial and vocational opportunities. If anybody wants to sell hot plates or do cottage food, of course, I've been talking to Sean about the permitting that goes along with that, but they are looking to do some really exciting work. Salvation Army is using their money to purchase mass amounts of foods. The demand on their pantry is huge, so they're building up their stock to be able to serve as many people as they can. And then National Hookup is looking to purchase some more refrigeration units. I was over there yesterday and they don't have anywhere to store their milk or their eggs. They're out of space, so they're going to get some new units and a delivery van. So that'll be some exciting stuff. And I'm happy to be able to use my platform to be able to bring in this money and provide equitable grants for our community. Any questions?
I have a couple.
Absolutely.
Did you explain what MAP stands for?
Yes, it's a bad acronym, but mobilizing for action through planning and partnerships.
I always get the mobilizing for action and then the other two. I
Yeah.
guess. But the partnerships are very important. Do
Absolutely.
you know, can you explain how many number of agencies and partners you have working together? Because when I come to the meetings, which are virtual and you're all welcome to attend, there's a lot of people.
Mhm.
Do you have a number of how many agencies and partners you actually have?
I'm upwards of approximately 90 different entities, and everybody kind of participates as their, job allows or permits. But I would have to say I see the biggest presence on my behavioral health and substance use team. I have upwards of like 50 people alone just on that one. And then my other teams, I usually see between 50 to 20 participants every month. So we got some pretty passionate people in our community. We're very lucky.
Are your partners mostly in the Joliet area since that's where the biggest need is, or is it scattered?
It's scattered, predominantly centrally located, but I work with Robert, our health equity manager, to bring in new partners all the time and make sure that we're getting into all those pockets.
And the community gardens?
Yes,
Yes, she smiles.
yes.
About how many of those do we have?
I believe we're in the 30 to 35 range. I know Kathy Bacora, that's her passion. She's fantastic at it. She's looking at opportunities for next season to find some new partnerships. I think she's going to be working with, I always want to call it Harvey Brooks, what's over there right behind Milano. Warren Sharp Community Center. Thank you. Thank you. Yeah, I think she's looking to work with them coming up next season.
And can the residents get to the gardens without having to drive?
Well, with them being like locally, of course, people in the neighborhood there are welcome to come at any point. The issue is I don't think people know about them, and there may be an educational aspect that's missing there. That's where a partnership with U of I Extension has kind of come in. Now, granted, their SNAP Ed educator was phenomenal, so she recently accepted a position, so her SNAP Ed educator position is vacant now. But she was really fantastic. They were working again with Warren Sharp and other agencies. They were doing community surveys, talking to the residents, seeing if anybody was interested in learning about gardening, learning about growing their own food. Would they be interested in using that food, again, for those entrepreneurial pursuits? And so we have some of that data, and we hope to be able to continue those surveys once Fernanda's replacement has been placed.
And I saw a post on Plainfield moms on Facebook, and someone was saying they wanted to get their family out to volunteer. And of course, I have all sorts of things to offer, but when it came to MAP, I really wasn't sure who they would reach out to.
You're welcome to reach out
So
to me.
just have
Yeah,
them reach
sure.
out to you
Send
and
me an email, a text, even leave me a message. I've been out and about a lot more with it being assessment season. I'm doing a lot of just meet and greets and site visits with people, even with the grant, but I'm around, I'm here, I'm busy, buzzing around.
Does anybody else have any questions? Thank you, Caitlin.
Thank you.
Moving on, we do have, when it noted that County Board Member Butler and Dean Schlotman appeared, and I want them on the register there. We also have informational reports, our monthly update from Elizabeth Bellotta with our health department. She had several reports in there today.
Good morning, everyone. Once again, I'm Elizabeth from the Will County Health Department, and just a real quick couple updates for my report. Today, this week is actually Mental Illness Awareness Week, so Dr. Burke is here and she'll explain a little bit more when she comes up to present. But in your packet, you did receive a IDPH news release regarding winter and fall respiratory virus season, and they just released another one regarding the IDPH urges Illinois to protect themselves from seasonal illnesses. So that just came out. They are also providing a dashboard of viruses, information where you can get your vaccines. And then the health department also put out a news release regarding having the COVID vaccine available on site, and you just have to make an appointment. I did bring with me, in case you had any questions, my vaccination team, not only the Director of Family Health Services and her assistant, but also our program coordinator for vaccinations, Lisa Carlson. So in case you have any questions about vaccines, our availability, how to make an appointment, they are here to answer any questions. Other than that, I really don't have any other updates to my report, but I'm just going to pass to Perla these news releases and she can get them around, or I can email them out. Will do. I just brought a couple extras to hand out.
Elizabeth, I would like for you to highlight a little bit more on the better birth outcomes. You had a report in there.
I will
I would like to hear a little bit more about that one if possible.
I will invite Sylvia Munoz, who is the Division Director of Family Health Services, up to the mic.
I don't know, I did forward an email. I don't know if everybody else got it. If not, let me know. It was an email about out of the Chicago area, a task force on maternal health and morbidity, which we had talked about a couple months ago. They were looking for individuals, and I did send that forward to the health department, hoping that we could, you know, get
on
in,
the task force.
get on that task force as well. It came out of NACO. So if you did not get that email, let me know and I will forward it to you guys if you're interested. More about the Better Birth Outcomes.
Good morning. Sure. Better Birth Outcomes is a high-risk pregnancy case management program. It is funded by the Department of Human Services. And it is nurse-run. And we have a caseload of 77 women, and they are like deemed the highest of the high risk within Will County. And they are not just looking at medical risks, but they're also looking at social risk factors. They'll look at, they consider a risk factor, low education, history of violence or abuse, history of drug use, and then of course, all of any medical conditions, anemia, obesity, hypertension, diabetes. The goal of the program is to help women have healthy babies and to prevent preterm labor and pregnancy complications. We have 2 nurses that meet with the women monthly. They'll do home visits. That's when you see the big picture. That's when you really truly see family dynamics, perhaps the physical environment in which she lives, any other interaction with other children in the home or any other adults if they're there. There is collaboration with their providers. So we have a monthly update letter that goes out to the provider, just informing them that we met with their patient this month. We checked her blood pressure. We discussed typical prenatal education. Concerns that maybe came up are also shared with the provider. And then we will get some back and forth dialogue as needed. So yeah, were there any specific questions that you had about it?
Well, I had seen that we had a 10% increase in the months of June, July, and August with 117 patients. I don't know if those were mothers, children. I'm assuming it's a combined.
Yes, that's our high-risk infant follow-up program.
And I was just wanting to make sure they had, enough access. Is this something that in the future we may need to expand on?
So the high-risk infant program, this one they're both kind of, they're voluntary programs. So for example, WIC is income-based. You have to have an income requirement. And for Better Birth Outcomes and high-risk infant follow-up, there is no income requirement. You just have to be a Will County resident to participate in the program. And so we have our referrals for the high-risk infant program come from the hospitals via IDPH. So there is a whole referral system, an electronic system that hospitals will complete the referrals based on the baby, the newborn's diagnosis. So anything from prematurity to a heart defect to drug exposure, they refer them to IDPH to us. And probably about 30% of those people actually accept services, which is very small.
It's small.
And why that is, I don't know. Is it because it's the health department and there's that stigma associated with, well, we don't need any health department help. We paint the picture of this is, for your baby, we're trying to help your baby kind of get to their max potential. If there is prematurity, a lot of these kids are at risk for developmental delays. So we are just an extra set of eyes for the families to kind of help, and an extra voice really to help them advocate for their babies, help them learn to care for their babies, and be able to access and be aware of the services that are out there. So I don't know I couldn't explain the jump in that month because I was kind of surprised by it as well. Why it went that high. It could just be a fluke that many people were like, yeah, sure, we'll take the services this time. And they range. We'll have people that are on the lower income side, uneducated, and then we'll have people that are nurse practitioners that want our services. So it's very hit or miss, it's just a guessing game at that point. But it is similar to BBO in that we do go out to the home there, and we provide the service in the home, assess the baby, weigh and measure the baby, discuss the medical care with the mom, and help them access, find any additional specialty services that may be in need. There is a collaboration with the pediatrician as needed as well, and advocacy. So we've had a lot of families stay in that program for the 2 years. It is until the baby is 2 years old. And then we will refer a lot of them to early intervention services. So.
Does anybody have any questions regarding the behavior, I forgot the name
Yes,
already.
all of these programs are free.
Let me get it right here. Better Birth. I was thinking Better Baby and that was not right. No, it's Better Baby, but Better Birth. Does anyone else have any questions for Sylvia?
And let
Thank
me just
you.
state really quick that there are a lot of home visiting programs within the county. But the difference between this program and the others is that this is a nursing based. And so you have that nursing, that nurse with their eyes there. And a lot of the other programs are home visitors that are trained for a home visiting type of program. But when you have a nurse there that's applying nursing theory and critical thinking skills, it really makes a big difference in some of these families.
Thank you so much.
Thank you.
So I did also see there are several dates, Elizabeth, that you have coming up. Your health equity staff has really been out in the public. I've seen them here, there, and everywhere. And there are some dates, the Veterans Resource Fair, the Home Halloween Fest, Community Connections Health and Job Fair, and the Veterans Day Ceremony and Breakfast. And I'm assuming those are open to anybody that would like to come?
Correct, yes. And we
So-
typically bring staff from our health equity team, but also other individuals. We set up a table, we give out our resource guide so that people know all of the services that we provide. Typically, we have COVID tests or masks or something, as a giveaway to, to lure them in so we can start the conversation with them about our programs.
So if any of you like to get out and do fun stuff, there's 4 opportunities this month.
And then don't forget to give us a call if you need any vaccinations. We are ready and able to take your appointments.
I did have one other question. I just go through these like a fine tooth comb sometimes. There is been several recalls. Eggs was a big recall. I know we had our lunch meats were a big recall. Is it calming down?
So, and I did actually bring my director of environmental health with us.
Are we good to eat our
Sean
eggs and our
Connor,
meat
so-
now? I need my proteins.
Yeah. Here, just share.
To your question, are they calming down? This past month, there wasn't as many. They didn't expand the Boar's Head lunch meat one. The Milo's eggs has been expanded slightly, so it is officially a class 1 recall now. So it's really kind of up and down with recalls, and there's lots of different factors. If I may use my cheat sheet here. So the Food and Safety Modernization Act was passed during the Obama administration. And what it really did is it created more teeth to the laws for our farmers, manufacturers, and processors. In the past, before this law was enacted, the FDA could not mandate a recall. So now they can if needed. Typically, recalls are voluntarily, and most all businesses do it voluntarily. Very few is there ever a mandated recall because it's just as important to them as is to anyone else that they recall these products that may not be safe. But so there's different reasons. So that's one of the reasons why you see some more recalls is from that law. Better testing, better tracing mechanisms are in place now. So the science is improved. Consumer awareness of food safety is dramatically increased, and we're all, from my perspectives, I think that's wonderful. I think that's changed over the time I've been doing food safety when I got out of college. It was kind of an afterthought for a little bit. Now it's really on the forefront of a lot of people's minds. There's a lot of manufacturing companies that have multiple brands that are packaged in the same processing plant. So there's opportunities for cross-contamination, not just with pathogens, but also with allergens. So, and mislabeling of packages is attributes to about 1/3-ish of all recalls. It's pretty significant, and sometimes it's just human error. And other times it's like the computer just didn't put in the right label or things like that. It's pretty,
Expand on that. I mean,
Sure.
I'm just sitting here, I'm thinking, how do you misprint a label
oh, it's
on
really
our
easy.
lunch meat?
It's not a misprint of the label per se. Maybe if I said that, I should have.
Or an egg.
Well, when you're talking about allergens,
Yeah,
okay.
Right.
So allergen specific, they're required to put those ingredients on the label. Okay. So if just think of yourself at a manufacturing plant and you're processing maybe 6, 7, 20 different items. So you're going to have your labels are pre-printed and they're going to be in big rolls. Okay. And sometimes this is in the warehouses where these labels are stored and these ones and these ones. And there's different rules for different countries. So you could have a plant that serves, sells food to both Canada and the United States. And I'm picking this one because I actually worked on this in the past at a different place. So they put the wrong label on their product it was supposed to go to Canada. They were supposed to use a Canada label and they used the US label. And it was just to grab the wrong stack, or they, in their computer system, when they go to grab it, it grabbed the wrong one. So that was about a $5 million mistake.
But if it's like, the ingredients shouldn't change
But
just because it's going to a different
So for with,
Place.
no.
The ingredients should be the same. It shouldn't be altered.
Not necessarily. Well, sometimes it is, and sometimes it's not. So in that example I gave you, it was the same product, but there's different laws in Canada than there are here in the US. So and how it's labeled on the package. Now, there are some times though where there are different ingredients, slightly. And then we're talking about allergens too. You really got to be careful because if you run a product on a line that has an allergen in it, the next product you run that line, it has to be cleaned and sanitized and then tested. So a lot of times they'll do the allergen products at the end of the shift or the end of the day, so it won't disrupt service. And sometimes they're really good about it and sometimes they're not.
Okay, Miss County Board Member Butler, you have a question? I will turn you on. It's my job. I can do that. There you go.
So could you explain to us on a label what natural flavoring means?
That's more a better question for the FDA.
But I mean,
Natural
it's
flavorings.
not necessarily natural.
Oh, I understand that. Yeah. And
So there's a way that labels are not correct. And for instance, on Fruit Loops that go to Canada don't look the same as Fruit Loops that are in America because we use dyes, like in the yellow dye, I guess it has petroleum. It's made from petroleum product, you know? And in Canada, they don't allow that. Where in like Europe, they use about 1,000 more chemicals that the FDA lets in America that they don't allow in Europe. So yeah, America puts a lot of stuff in their foods that's not good for you, but we don't really pay attention to that.
So even though we do enforce and follow up on the recalls for any products that are food related, we don't, as the public health department, regulate the manufacturers. The local health departments only regulate the food service to the end consumer. So the small, the restaurants and the small businesses. So we, even though those do come through our office because we see them in the stores as we're doing inspections and we do have to get the word out, we don't have any ability to regulate the manufacturer or the wholesaler at this point.
yeah, and we don't set the definitions of natural flavorings and things like that. It's a good example where it could be vague. There are certain way the laws are written, how you could say if something is fat-free. It's not fat-free, it's mostly fat-free.
Cage free,
so-
cage free
But
for your
it's just-
eggs.
it's Same thing with organic. Organic generally means pesticide-free, but doesn't necessarily mean that it's good for you. So it's just how your interpretation of that is.
I know the big thing about cage-free animals was your eggs.
Yeah,
Was so they let them out for,
a certain amount of time.
certain
right?
amount of time.
They're probably in a pen, but just not in a tight pen. I think
Right.
that's
So,
how that definition is.
yesterday, this is a little off of that, but it does have to do with our food and inspections. I was having a conversation with a young county board member, and I mentioned, we were talking about food and all the recalls, and I said that there was a time in history when pink slime was the big topic. And then I started looking it up. Is pink slime still used? This was just last night, so it's fresh in my mind.
So if I
Pink slime
remember,
still used in our foods? Because it appeared to so when I was looking it up.
I remember this one. It's for me, it was a confusing topic because for what we do here at the local level, we do restaurant inspections, food service inspections and whatnot. So when we use the term pink slime, it wasn't the same term that they were using in that story. Okay, so the pink slime that we refer to tends to happen in ice machines where, it's like a mold or a yeast that's growing and it's got a pinkish hue to it. And you typically see it in a very specific area. And so it's always been referred to as pink slime by us as inspectors. The product that you're referring to, I believe, was identified in a fast food chain's hamburger patties.
And Taco
And-
Bell.
Yeah, and it wasn't unsafe. It was just gross. And I hate to say it that way, but that was the story. But it was a big story and it went national. It probably went global. A lot of money was spent and lost by multiple people, but there really wasn't a health concern with that. Was it good marketing? Was it the best thing to do? Probably not. I would say a USDA representative would be a better person to explain that, but that was my take on it at the time. There's a lot of things that happen in manufacturing processing that the average person would probably shudder to see. It doesn't mean that it's unsafe.
The
It's,
Jungle Book brought it about originally, and I think it's gotten better, but I'm sure you're correct.
Well, that is the unofficial birth of the FDA is from that book.
Correct.
Chair Freeman?
Oh,
may I-
yes, go ahead.
So I just
Dan.
wanted to say that if you go to the store and there's ground beef and it's red, then yes, there's something been added to it. If it's not brown, that's the natural color of meat. And just because the USDA or says that it is not a health risk, does not mean it's healthy for you.
Correct.
And that's where we're at in this country. It's death by a thousand cuts of things that are not healthy for you, that all of our NGOs allow big business to put in our foods and we ingest.
Yes, and I'm thankful that they were it was Listeria.
Yeah.
I'm glad it was caught. I'm glad it is on the
Are you
menu.
referring to the Boar's Head
Boar's
one?
Head.
Yeah, the
And li-
report that was in here
Oh,
was
okay.
talking about Listeria, so.
Listeria is everywhere. So that's why cleaning and sanitizing is so important. Because you can get it on your shoes and track it into the plant, and then it gets spread throughout the plant. And it's just ubiquitous to the environment. It's just there, you know?
And
Um,
it's highest risk to individuals that are immunocompromised or pregnant women. So it is important for
Yeah.
anyone who is, immunocompromised or pregnant, that they do really watch what they eat and really make sure that they don't eat things that Listeria seems to tend to, which is like a lunch meat or
Sure.
a hot dog or something.
Wash your hands more.
Wash your hands is
Period.
always a good advice. Mom was always right on that.
Yeah.
Yeah,
All
absolutely.
right, thank you so much. Does anybody else have any other questions? Okay,
Thank you.
thank you. Next up is Maggie McDowell with our Sunny Hill Nursing Home. And while Maggie's coming up, I don't know if how deep you went into the presentations or the reports this month, but in October 25th, they're having their barbecue and bake sale.
Yeah, no.
And I don't know if you like to bake, but I do believe they take donations. Am I correct, Maggie? I'm sorry.
On?
There you
Okay.
go.
Good morning, everyone. Yes, so if you like to bake and you want to donate, please drop those off at our reception area. We'll be happy to. Our bake sale is a big part of this fundraiser. So this is run by our friends of Sunny Hill. And they run different events throughout the year. And all of the monies goes towards those items that are not covered under the regular budget. And if we identify some items that maybe the residents need or want, we will advocate to the Friends of Sunny Hill. You know, our bus service, all our TVs and the rooms, all were purchased through funds from Friends of Sunny Hill.
Is there a date that, I know last year you had a specific date you wanted the baked goods there by, and do we have to label them with ingredients and prices, or is that?
Correct. And we have the details of that. I'll share it. I'll send an email out so
Great.
everybody has that
Because the date
information.
is very important.
Yes.
They don't want it too early and they don't want it too late.
Correct. Just a couple of, I think, 2 days prior, but I've a flyer information on that. I'll share
Yes,
it
please do that.
with
And
everybody and it can get emailed out to everybody.
before you jump in, I think we have a question.
I just have a
from
question, like what kind of
Mitchell?
items, what kind of items do the residents need?
It varies. The beauty shop last year, I needed to kind of do an update on the beauty shop, and I went to the Friends of Sunny Hill, and they were able to fund the different items that were required in there. There were only smaller items like towels and sanitizer, especially for the items that are being used in there. We repainted, we redecorated the beauty shop, and they funded all of that. I had a resident that was hard of hearing and needed a special device. It cost about $200. She's 103 years old, hard of hearing. And when she was a member of our resident interview panel. And when we interviewed candidates, she had a hard time hearing them. So we purchased, or I took that to the Friends of Sunny Hill and they purchased the item for her. So it's things like that. They also do all the upkeep and renovations on all our 3 patio areas. So when we have that work done, the routine landscaping and updates are done obviously by our landscapers, but the additional items that we put out there, they fund all of that.
Okay. Thank you.
So is there anything specific like the residents need, or
Not at the moment, no.
we got plenty of socks and?
Oh, yeah, all of that.
Okay.
There's no issues in that area.
Well,
Yeah.
I will let you jump in. I do know that there was some confusion this month. You were going to bring forward a resolution and it did not make it on.
Yes, and
But
that's.
the information is in here.
The information is in the PowerPoint. We will be addressing that in
Yeah, I
more
would like to
detail
talk
at the
about that
upcoming
so that-
meeting.
Since it's in our report,
November.
I do have a couple questions about it.
Sure.
So maybe we can get a jump on it before it gets here next month. So
Okay,
go
that's
ahead,
fine.
I'm sorry.
Well, again, we have put forward a request to the county executive and to the county board to increase our daily private pay rates for residents at Sunny Hill. Now, this is something we do periodically. Most other nursing facilities, this is a standard. It's done on an annual basis. We haven't chosen to do it annually. Pretty much, there's been a number of years where we have not raised our rates at all for private pay residents. It's been 2 years since we actually requested an increase. So we are looking to request an increase going forward. The increase would be obviously for all our private pay residents, which at the moment, I believe when this was written up, we had 38 private pay residents. And we're looking for an increase of $50 per day. So this would estimate an increase in revenue of $689,450. Many of our private pay residents also have made application to public aid, and they're on what we term a spend down. So over a period of time, and it typically takes about 18 months to 2 years for the public aid process to kind of run its course. One of our specialists in our finance office assists family members and residents with this overall process because it can be extremely confusing and it is kind of cumbersome and laborious. So they kind of walk them through the whole process so that they can get on public aid. According to our 2023, which was the most current public aid cost report, Sunny Hill's total cost per patient per day was at $410.42. So that's what it's costing us for each resident. Now, we also did an audit in terms of looking at what other facilities in the kind of immediate area are charging. The daily rate currently is at $315. And we're looking to propose an increase to $365. Now, the other facilities that I've listed, like Lamont Rehab, Franciscan Village, Smith Crossing, Alden of Shorewood. Again, I included DuPage Care Center because that obviously is another county facility. I wanted to kind of have that as a comparison. And then, of course, Ascension Villa Franciscan. So you can see currently what all of those different homes are actually charging, which is in excess of what Sunny Hill is charging per day. Also, I did a room rate comparison and also kind of outlining the skilled private room rate and the semi-private rate. Now, we've retained a couple of semi-private rooms. Most of our rooms are private. And the reason that we've retained semi-private rooms, because we do have residents that, want to stay together. Like we have a husband and wife that may come in and they want to stay together. Or more recently, we've had two sisters, twins that came in. And of course, they've been together all their life. and they wanted to stay together, and we're able to accommodate that. And more recently, we also had a brother and sister who wanted to be together. So when we have the semi-private rooms, it allows us to actually be able to accommodate that. So our rates are inclusive. They include, items like oxygen, wheelchairs, all the other services. And Sunny Hill is the only place that offers all those additional items at no cost. All your other facilities that I've listed there, of course, Sunny Hill is what we term an inclusive rate, whereas everywhere else is actually charging additional fees, including the daily rate, the additional fees for all of those other services that they would provide.
So we do include the prescriptions.
The prescriptions, if somebody is on Medicare, those are included. On Medicaid.
On private, they're
and-
extra.
Correct, yeah.
Okay. Member Costa, you have a question? I will turn you on. There you go.
Thank you, Maggie. You answered my question about what makes the rate inclusive and like what is not included with the
Yes.
other facilities in the surrounding area. I mean, I think even with the increase, it looks like Sunny Hill is just doing a superb job with a 5-star rating and really giving our local residents who go here a good deal. My question is if the total cost per patient per day is $410 to Sunny Hill and it's currently $315, what's making up that difference?
The county is picking up that difference.
I see.
Mm-hmm.
Yeah, I think it makes.
So
sense.
that's why,
Yeah.
it does make sense to obviously increase the rate. And
And the rate is
especially-
still coming in under other kind of
Correct.
competitor.
It's still
facilities.
it's still less than what our competitors are charging.
Yeah.
Yeah.
Thank you.
And like I said, because it is inclusive and that inclusivity, I mean, can end up being pretty expensive. I mean, the oxygen, the wheelchairs, all the other items that are, other places are charging for individually, that can be pretty substantial.
I have a question.
Mr. Butler was next. Hold on.
Okay.
Mr. Butler? Then I'll get you. Oh, I hit you, but I didn't hit on. There you go.
Okay, together.
So I know that we went over some numbers in the past. There was a line that said that some of the workers were only making like $12.50 an hour.
Who are you referencing? Are you talking about
Some of the
the staff?
Staff,
Are you
yeah.
talking about?
Mhm.
I don't have the staff rates. That's already preset in our CBA for what
I was
the
just wondering
staff
if this
rates are.
increase was going to be enough to like.
The increase is in the resident per day cost. When we review at the union negotiations, when the CBA comes up for renewal, that's when we look at all the staff. And I believe at our last union negotiations, the lowest rate was like around $15, $16. So I'm not sure where you're getting the
Might have been a
$12
typo.
from.
I know it was a matter of contention. When we were looking at $12.50, we're like, how is anyone working for $12.50 with our, our elderly, when we want to take care of?
Mhm.
So I was just concerned that if that's not the case, that's fine. I just want to make sure we're asking for enough so that we can pay people a little bit more to do that job.
The rates were all set when we sat and we reviewed all of those at union negotiations. Obviously, that doesn't seem that long ago, but it's coming up for renewal again this next year. So those rates were all reviewed and revised in light of kind of what the current rates were within the long-term care areas. So those are already established. And like I said, bless you. And I believe, and don't quote me because I don't have it in front of me, but I believe our lowest rate that anybody within any department is getting paid is about $15, $16 an hour.
I'm curious, are those some of them part-time workers?
We have part-time and we have full-time
I wonder if
workers.
they Took the part-time and then divided it into like a full-time.
I could not.
Yeah,
answer.
I'm not sure
Yeah.
where you're getting your data, but
As long as they're not making $12.50, I'm happy.
no.
I would agree
They're
with
not
that.
getting $12.50.
Member Mitchell?
I have a question. It's just a matter of curiosity. So it's related but not. So when we're talking about skilled private pay, that means that somebody out of their own pocket pays $177,000 a year, say for the average daily rate. Is that what you're telling me?
The residents, yes, pay privately based on, you know, their circumstances until, like I said, and then we work with them because they're on a spend down until that money is exhausted. And then they go on to, they qualify for public aid.
Oh.
So right. now-
And the majority of our residents are actually public aid. So we have 38, as of this, we have 38 private pay residents, and we probably have maybe 8 or 10 Medicare, but then the balance of 156 residents is public aid.
So right.
They're
now,
already
right-
on, receiving public aid.
Oh, they came in on.
Or they came in on public aid.
Okay.
A lot of times residents will come in private pay and like I said, go on this spend down. And then once the funds are exhausted, then they are, you know, based on their qualifying factors, then they'll qualify for
I
public
think they
aid.
qualify after they sell all their worldly possessions too. I think.
Yeah, and like I said, most of our residents are, you know, the highest percentage is public aid because that's what we cater to.
I was
We
just-
cater to those people that are in the most need.
I was, you know, and I probably didn't ask this the right way, but I kind of knew that part. The piece that I didn't understand was the Medicare piece. So the Medicare piece for the pharmacy, for the medication is done separately. So that's not included in that, right?
Correct.
And so
Correct.
even if they're on public assistance, they get the public assistance and then the Medicare portion of it.
The medications for your public aid residents is paid for. If you're on Medicare, then obviously that is paid for through Medicare.
Gotcha. All
Okay.
right.
So I do know my aunt, she's a retired brigadier general. She is out in Fairfax, Virginia. She's paying roughly 17,000 a month
Oh, yeah.
for an assisted living.
Mm.
So, and I know that it's more expensive out in Fairfax, Virginia. So we'll go to my mother-in-law who is in Southern Illinois and she's paying, you know, roughly 8 or 9,000 for assisted living. This is a full skilled nursing home where they're getting a lot of the services. Like my mother-in-law, she has to pay for someone to come and, you know, take out her trash or sweep her floor or.
Yeah, there is a difference
than
in the
extra.
levels of care. The levels of care for assisted living are very different in the prerequisites than for skilled care.
Right. And so for skilled care to be a little over 10,000 a month. And I agree, they take all your worldly possessions that you've worked so hard for your life to give to your children, but it's how the system is set up.
Yes, it is.
And we can't fix that, but we have to be able to make sure that our residents are healthy and safe.
Absolutely.
So, and, so I
Welcome to
personally
the
do not have a problem with the 50 because that still takes us down to comparison to even less than what some of the other county homes are sized are charging. Is that correct?
Correct. Yeah.
Okay. Does anybody have any questions?
Brilliant.
All right, pardon?
No, this will come up on the November agenda.
Yeah,
for-
there was some confusion and we didn't get the resolution, but I wanted the conversation to happen. So if you do think of questions, next month it'll make it a little easier when the resolution does come forth. So
Yes, thank you.
Guess
Any
he
other
has-
questions on
he has to give
anything else?
30 days notice.
Yes, regulation, IDPH regulation is that I have to give families 30-day notice prior to instituting this. My goal was to roll this out as of January 1 of 2025.
So it won't come through until December now, so it'll be after the new year.
Yeah.
So, okay, thank you.
Okay, any other questions before I finish? Okay, thanks, everyone.
Oh, I have to make a statement. Newsweek, they won't let you say it, but I can. Newsweek, number 3. That is a reason for applause.
We can share the information internally only. We have to pay for it if we want to do any external promotion of this. And that's,
Who's it?
Like,
oh, you,
10 or
over
15,000.
I think it's 11,000, almost
Okay, yeah,
$12,000. Yeah. And we've always opted not, obviously,
but
not
we
to,
can share
not to
that
do that.
information. She can't, but
Right.
we can. And number 3 is pretty impressive.
We were number 14 last year, so we're down to number 3 this year. So
So,
for what it's worth, because we can't promote it and we
Yes.
can't put that out there anywhere, but
yeah, but I can.
okay.
And the other one is you had one more. You had the longevity awards. Obviously that was for residents.
No, that was for our staff.
Okay,
Staff longevity awards.
so I
We
was
had
mistaken.
staff that were, we acknowledge staff that are 15 years to 30 years. We did have a couple of staff earlier this year and last year that were 33, 34, and 35 years, but all 3 of them has retired out. So we have a couple of staff that are now 30 years, and most of our staff were anywhere between 15, 20, 25, and 30. So I believe we had 16 staff in total.
And there's 2 that are sitting in the front.
They were
they
2 of our
seem to be pretty
residents, and they
special.
assisted with the presentations with the county executive. So they assisted her to present the certificates and some flowers and some cards to the staff members.
Wonderful. And then I had one more other question because I read this stuff. Verkada, did I pronounce that correctly?
Yes, you did.
It's your new sign in. So
Yes.
do you still have the person sitting in the front? It's just easier to check in now?
Well, this is an electronic check-in system, and the one that we previously had was with JNL Screening. Unfortunately, their system wasn't going to be supported as of December 31 of this year. So we had to go out and look at getting a new system if we wanted to be electronic. So we had worked with Jason Donish in IT, and he had actually been working with this company for some other IT related issues. And he made the recommendation. We started working with them. We started and rolled this out as of October the 1st. There has, as with any new system, there's been a couple of kinks, a couple of bugs that have to be ironed out. And IT is working on that right now. But essentially the system for us, the only thing we wanted was to have an electronic means of checking everybody as they come into the facility. Now, the newest update was people would have to present their ID, their driver's license or some form of ID. We also had the option to run a criminal background check or a sex offender check. I had not initiated any of that because those are things that we're looking at. We really just needed it so that we could have an electronic means to run a report for life safety if something happened within the facility, so that we would be able to instantly establish who was in the building and what we needed to do. So as of right now, we have put a hold on individuals using their ID because there's been some, like I said, some kinks, some wrinkles in the system that it wasn't working the way that it should. And then obviously we have not turned on the other capabilities, but we're just still exploring the potential within a nursing home as to the possibility of maybe potentially I'm working with Mary Tatral to get some further information on that. But as of right now, it is simply a check-in system that we can run a report to see who's present in the building at any time.
Okay.
And we've dispensed with using the driver's license or the ID for the moment, but that's something we may initiate at a later
Well,
date.
please keep us informed because that
Yeah.
is
Okay.
interesting to me.
Oh, one more,
Oh,
one question.
Turn it
I'm
on.
coming, okay.
You don't have to have my
Okay,
permission.
one question. So if you're a frequent visitor, I'm a frequent visitor, I'm gonna see my mom, I go every Sunday.
Yeah.
Say for instance, does the system record that and so it makes it easier for check-in for the next time?
Correct. And with this system, even if we had you use your ID, you can just click on an icon that says it'll retain your information for 90 days. But after 90 days, then you would have to re-input all your information again. But you can, with the new system, you can pre-check in before you even come to the facility. And you can check out if you forget to check out at the reception desk. It'll send you a text message to say, are you still at Sunny Hill Nursing Home? And then you say yes or no, and you can check out remotely as well.
Thank you.
Okay, thank you.
All right. And now we have Dr. Burke with our substance use initiatives. Oh, got to turn you back on. Can you hit your button, please? And then I get to do that. There you go.
Thank you. Good morning, everybody. I want to start out with really good news. As all of you probably know, that we've been launching a recovery community organization in Joliet called Recovery Community of Joliet. It's in its new facility. We will be having an open house. But I'm very pleased to say that they just got their 501c3 status, which was critical because that's going to allow them now to apply for funding. Up until this point, they would have the funds that we provided them as their launch, and they're happy now. So I'm pleased about that. The rest of my report, I want to draw your attention that our opioid overdose deaths are down. We had 39 as of September 16th, and we're running this year at a 42% decrease than last year. That is so significant. Now, sometimes you say it out loud, you don't want to say it because it'll turn around, but that is a significant drop. That goes along with the national average of people are, nationally last year it was a 10% decrease. We had a 17% decrease, and everybody's trending down. Now, that does not mean you're trending for the disease. That just means that people are not dying from opioid use disorder like they were initially. And within our county, we use a strategy of getting Narcan into the hands of everybody so that that death is not fatal. One of the other items that is at a shortage in our area and nationally is long-term recovery. So treatment centers and recovery homes are all on short periods of time, when in reality, opioid use disorder is a chronic disease. People will have it the rest of their lives, and it needs to be managed the same way you would manage diabetes or high blood pressure. In your report, you'll see that Joliet still has the largest number of deaths, followed by Romeoville, Crest Hill, and then Lockport. That has been consistent along the way, but that's where we see the majority, and that hasn't seen any change. It follows because those are the largest populations that we have, but it's still, they're high-risk areas, so we spend a lot of time in those areas making sure that people have support. Last month, we were at 61 different locations. Elizabeth had mentioned all of the community events that the health department is at. You will also find my rapid response team there also. We go to all the fairs, the trick or treats or trick or trunks. It's been a very, very busy summer. And I'm pleased to say that we've passed out over 1,113 boxes of Narcan this year, or this month. The red boxes are extremely successful also. That's providing easy access for people.
So
Fentanyl test.
I'm going to stop you for a second. The Narcan distribution boxes, the red boxes, I know that I have taken some out because I want them in my car. I want them. You never know when you may need one. And by golly, I've had the training. I'm ready to go. I'm going to save a life if necessary. Do you have to replenish them frequently? Is that how successful they are, or is it just hit or miss?
No, because each box holds 60 boxes, or yeah. And we replace them routinely. The areas that are the busiest is the courthouse. that there's two there and they turn over quite a bit. And then the health departments, but also in the library. So they're being used. And I get calls a lot for people wanting Narcan, and I can direct them then to their nearest box so they don't have to come into the health department and pick it up. So that's working very effectively.
Excellent.
And I'm pleased.
And I think we have a follow-up question with our vice chair here.
I was gonna ask you a question. I'm like, but you wouldn't know that. How you wouldn't? You may like for the Lockport, Romeoville, Crest Hill area. Where I mean, have you increased the number of boxes or places where you can get the Narcan?
Actually, those are the 3 communities that have them in their library.
Oh, in the
So
library.
they were first on their list to, that they were the only ones that we have in a library right now.
And I know some young folks that are going to Halloween parties, upcoming parties for Halloween and this and another, and I'm like, you know what? Bring Narcan with you because you never know.
You never know.
And so the strips, where are those? Where are
The
they?
fentanyl test strips,
Mhm.
we also have some of those in our boxes, but not a lot.
Now is the time to get them out. Is there any? I'm just saying because of all the upcoming, parties that.
We see a large demand around prom time, and we see a large demand whenever there's an event for kids going off to college.
Yeah.
We get a lot of, so we're in the swing of that. And I have to say that people are very, very comfortable now asking for it, where a couple of years ago, they wouldn't even have put it on their agenda of what to send my college kid away with. But this is now part of what they do when they're going to parties, when they're going to events, when they want, and it's not any indication that person might use. What it is, they may be around somebody else who's used, and it's a public safety activity to have Narcan. And now that it's in the schools, it's become much more able for them to talk about it, to request it, and people are more comfortable with it, lessen the stigma.
We also have a follow-up with Member Butler.
Oh, so about that, that first graph you had on there where it showed that 39 people died and 42 people, or 41 was reversed. And based on that last bit of information, are we roughly saying there's almost like 80,000 doses that were passed out?
We've done not 80,000.
But 60 per box, and there's been like 12,000 some boxes?
Total of all my boxes, not just in the red boxes, but all the events that we've been passing out. Yeah, last year we passed out over 14,000 boxes.
14,000 boxes would be even more, like
Yeah, no.
hundreds of thousands of these doses. So would it be safe to assume that since only 41 were reversed, that number is just coming from people that went to the hospital?
Actually, that's not for people with the hospitals. That's people who usually it's police departments, they send their reports to me because
So
it's just
sort of-
my information. And the
Because
report-
that number could actually be much higher.
Yes,
Because people are just doing it independently. Because I mean, if there's hundreds of thousands of doses out there, surely more than 41 people used it.
actually, that information does not include the hospital data. And the hospital data is reported to the Illinois Public Health Department, and the Illinois Public Health Department then releases that usually a year, 2 years later.
Do you have a sense if that number pales in comparison to private use?
It's really hard. Yeah, that's really hard to tell
Because
because
41 seems like a very small return, like for how many went out. I'm just trying to get a grasp of like how many lives. It would have to be a much bigger number,
I wouldn't.
but you just can't verify.
No, I can't verify it. And I wouldn't assume that just because the Narcan's in the community, that means there's that many users. And that people are using it privately and not reporting it. Because one of the things we do ask is that when we give it out at our public events, is that they do contact us and let us know about it. And occasionally we get that. But that's not I wouldn't consider it a large number of people who are using. Let's put it that way. We're preventing deaths for those who do use.
So I just have to, because I'm thinking there's some confusion. I just want to be sure. There's per box, there's just 1 dose, 2 doses.
2 doses.
2 doses per box, because it's one for each nose,
Well,
nostril.
just 2 doses, yeah.
So 2 doses per box. So, you take that times the 12,000.
Boxes, yeah.
Okay.
I
we
just
also
have-
had
I
a
just have
question-
a-
60, I didn't know what that.
That's the number that's in the red boxes. So each red box holds 60 boxes.
So we're not, when we say 12,000, we're talking about the other boxes, not the red.
We're,
boxes.
no, we're including all the Narcan that's been distributed.
Okay, so I have a question.
She's talking about one box.
Now, because I'm not even Narcan. But after dose of Narcan, I know I should know this answer. We talk about it all the time, but I don't.
That's okay.
What happens? Do they go to the hospital, or you just give them a Narcan and they're fine, or what usually happens after that?
And I teach this when I train people how to use Narcan. We want them calling 911. We want them to go to the hospital because we don't know if there's any other residual drugs in their system. And with the increase in xylazine and other types of drugs in the drug stream, they may have other physical problems that need to be addressed. Long-term drug use causes lots of other issues.
Oh, for sure. Yeah.
Yeah.
So I was just wondering if, because also I understand how folks in that sphere might be like, they don't want to go to the hospital. They don't want anybody to know, and other people are trying to protect them. So I'm just wondering, do they typically go to the hospital when this happens or not? That's all.
So there is a population that doesn't even call 911 or call anybody. So that I can't estimate. And different communities around the Illinois area have different issues around that. If you are one of our response fire or police respond, then they're going to want people to go to the emergency room. You can sign a sheet and not go. It doesn't happen a lot. One of the issues that we have in our community is when they go to the emergency room, we have not implemented any kind of services that help them withdraw in a different way. So when you give people Narcan, they immediately go into withdrawal. And so they're sick, and they're very sick. And that sickness often drives people, if you don't have an intervention between then and when we let them go, they will go out and use because they're sick. So in our emergency rooms around the country, there is a medication, Subucade, that can be started to assist people in a short-term relief until they can get to care, because you can't get to care 24 hours a day. And so it allows people to get hold of a doctor who can help them withdraw from that drug or maintain a healthy medical perspective on what they need to do to maintain their health. So we, and I've brought this up, that's unusual for an emergency room this day and age to still not be able to provide that. It has to do with the physicians on staff or under contract and whether they've been approved to be able to give this drug. And so it's been brought up. I highly recommend, if you know anyone in the hospital board, that you bring it up, because it would help people tremendously. We can't get people into services overnight. We can't get people, and they're going to be sick. So they're going to go back out and use so that they're not sick, because the reason people use once they have a long-term dependence is to not be sick. And so there are medical assisted treatment strategies now that help a person be able to be in recovery without being sick.
We also have another question from member Diaz, sorry. So go ahead. I got to turn another phone on. There we go.
Two things, real quick question. So if I'm at home and I wasn't a county board member and I called 988 and said, where could I go get some Narcan that's close to my home? Will they have that same information to be able to talk?
You always have to answer the really difficult questions.
Sorry.
Every one of those folks have been trained. The 988 system, it depends on who the person calling. Right now, our system isn't necessarily connected to individual locations. And they, hopefully, what they do is in our area, they would send someone to our 590 program. And our 590 program is run through the health department, and all my folks there know.
Perfect.
So
Well, that's for the public, for them to know. Second, and correct me if I'm wrong. Think of the red boxes that are out in public at the library and the courthouse is like free vending machines with the littler Narcan boxes. Is that a good way to describe it?
Correct.
So that's for the public to be able to help
Right.
access it and get 2 doses with each box.
And it's easy access. Those big vending
Correct.
machines are a little more complex, and we chose to go with something a little less complex.
And a couple of them do have the fentanyl strips in them, but not very many.
That's awesome. Thank you.
So,
Thank you.
all right, continuing on, because the next one is also very important.
Sorry.
Before we
So one of the things I wanted to talk just briefly about is the emerging drug trends. There are different types of synthetic drug trends. So fentanyl was the synthetic opioid when it first hit the marketplace that was so deadly because it was so much stronger than heroin. Well, now you have other synthetic opioids that are stronger than fentanyl, which is problematic. If it's an opioid, naloxone will work. But if it's not an opioid, it will not work. So we're seeing drugs mixed with benzodiazepine and other types of anesthetic drugs. And Narcan will not work on those. So one of the most important things that we do is get this information out to people. So that one of the reasons we have fentanyl test strips, we also have xylazine test strips included in that. So they can test drugs for both of them because both of them are deadly. The benzodiazepine issue is scary because benzodiazepine is Xanax, and it's a common drug that's being put into pills. And it's the prescription medication that is deceptive. If somebody gets prescription medication from a friend or from the internet, the chances are it's been laced with other drugs and it will die. And one of the things that we want to stress for everybody, because when people are have a chronic illness and they're getting a medication for a long period of time, it gets very expensive. If perchance they are trying to find an inexpensive way to do that and they go to the internet for a prescription drug and they get it from a pharmacy they think is reputable, it could very well not be reputable. And so there's no way of knowing. So the conversation is, do not buy things on the web. That is not a safe way to get your medications. That does not mean that if you have a delivery from Walgreens, that it's okay. So I don't want to scare people.
Right.
But it does mean that if you're just looking for an inexpensive and you think you're going to Canada and you think you're going somewhere else, that chances are you're not.
Oh, I have a question for you. So is there a street name for any of these yet or no?
Is there what?
Is there a street name for any of these yet? Are there street names for them? Like, so if
I don't
young
know.
people are talking about it, I want to
Well,
know.
Trank is the xylazine. So
Okay.
Trank is xylazine, and that's as far as I go.
I'm just trying to be hip, Dr. Burke.
I'm
just,
not as
no,
hip
I
as
just want
I
to know.
should be.
I just want to know what they're talking about so I can, so
No,
we can get-
in fact, I will research that next time and bring, because often we get that from the police departments. We get or the FDA, or not the FDA, the DEA. They know what all the street names are. And so I will bring that to all of you so you can all be hip.
Well, no, if they're
So you
talking-
know
right.
what the kids are talking.
Right, yeah. I'm trying to say no.
And so what they're doing, correct me if I'm wrong, but they're also using these to lace other drugs with. So like their crystal meth or their whatever they are flavor of the month may be, they are lacing it and then it becomes an issue. No. Why isn't it coming on? I cannot get her on. I am on now. Let me try. It still did not come on. I'm on. Nope. Can you hear me? Is mine coming out?
11, I see it's on.
11, mic on. Nope. I'm the only one that gets to speak now. Um, Would you like to carry that over there to her?
One way to control
Oh, here we go. I got one now. Okay, so please take a read and understand what the new drugs are. The other thing I wanted to let people know is this is National Recovery Month. And I stress the fact that we say recovery. And recovery is a lifetime process. It is not a 30-day treatment. Remember that, and remember that do not shame anybody who may have a reoccurrence of use, because we know that you have to build your skill set and you have to be under care your entire lifetime. The other thing, while I'm talking about Recovery Month, this week is also Mental Health Awareness Week. And just as substance use is a chronic disease, mental health is a chronic illness that needs to be managed and needs to be addressed and not stigmatized. It's very important that people are not ashamed to acknowledge there may be an issue and to seek care in order to have treatment without anybody judging that. This week in particular is being focused on businesses and businesses providing that kind of service for their employee, which is critical, because if somebody is suffering, and a lot of times people will want to hide it, and that will only complicate things. And so again, there is no stigma associated with either one of these diseases. However, we reflect that often in our language and in our lack of access to care. Part of what we're doing in MAP is developing a stigma campaign, actually, in order to address some of the issues so that people feel comfortable being okay with being in recovery without having to hide it or without having to be afraid that someone's going to find out and they're going to lose their job or they're going to lose something else. So it's really important that we acknowledge that both substance use and mental health are very, very important from a county perspective to address for all of our citizens. And the only other thing that's in my report is about the Naloxone Plus program. So when you were asking about what happens when someone overdoses, we have a program, and we created these cards to be able to pass out to the individual. We distribute to the police officers and the fire departments so they can give this to the individual who overdosed as a follow-up. So if they're not willing, they can't do anything or not willing to do anything at that moment, they do have information on how to reach out for care, how to reach out for one of our peer support specialists. If they just want to talk to somebody who may have gone through the same thing they're going through, we provide that at the health department. And that's really important because often that's what they need, that advocacy and that support to be able to take the next steps toward recovery. Any other questions? We were kind of jumping around all over the place, and I hope I covered everything.
Do we have any other questions?
No, thank you. Thank you.
Thank you, Dr. Bergen. Thank you for everything you're doing. To think that we are down 42%, I think that's great. I'd like to see it that percentage higher, but I will take 42 today.
You know, I'm really thrilled because we were on the verge of being higher than last year, and then we slowed down. And so that's really good. You know, I'm a public health educator, so that means if prevention and reports are going out there, we're doing our job. And that's what's really important.
And I mean, we can get, you know, our facts. We don't have all the numbers, and we may never get all the numbers because people are taking those naloxone boxes, and like Member Mitchell mentioned, they maybe aren't coming forth after they have, you know, saved a life, but it's a life that's been saved. And sometimes it takes us a little longer to go get the help we need.
Well, and we monitor that from a professional standpoint. The group that also does this in other counties, we monitor all that, and we have a meeting once a month to discuss that so that we're on top of what's happening everywhere. And so because, you know, counties are right next to each other. There's no such thing as one county has something and the other county doesn't. If you're right next to each other, you have to be prepared that that same issue is going on. We are different than Cook County, that's in Chicago, but that's our population is different. So you expect that illnesses to be different too.
So thank you very much.
Thank you.
Do we have any public comment? No public comment. No public comment anywhere? Okay. I have no announcements. I've kind of been announcing them as we go. There's lots of opportunities for us to volunteer and donate our resources such as baked goods. So, you know, the dates are in the reports. So, you know, have some free time, get out there. We have no need for executive session. Can I get a motion to adjourn?
So move Mitchell. Second Williams.
We have a movement from Mitchell and a second from Williams. We are adjourned until November 12th at 9 a.m. Thank you.
I am not